The Rajanagarindra Institute of Child Development, Department of Mental Health, Ministry of Public Health, was established in 1994 under the name Northern Child Development Center. It was originally opened on January 16, 1996, with Her Royal Highness Princess Mahachakri Sirirong presiding over the opening ceremony. On March 31, 2003, Her Royal Highness Princess Kalyani Watana, Princess of Narathiwat, kindly changed the name of the center to the Rajanagarindra Institute of Child Development, or RICD for short. RICD is a specialized hospital providing medical services to children with developmental delay and mental health problems such as autism, ADHD, cerebral palsy, learning disorder, and intellectual development disorder. RICD also provides and promotes support for academic and technological research and development to related agencies in order to improve child development and mental health. The Rajanagarindra Institute of Child Development offers services as follows. The outpatient services provide diagnostic and medical treatment for children and adolescents by psychiatrists and pediatricians. The inpatient services provide medical treatment and nursing care for children with developmental delay and behavioral problems by providing information and training programs for caregivers to enhance development of their child's behavior, both at home and in group settings using therapy activities such as sensory stimulation, art, behavioral modification, and self-caring. Moreover, assessment and mental health care of caregivers is also included. The Child Development Screening and Assessment Services provide screening and assessment of a child's development in order to understand developmental and behavioral problems, as well as planning enhancement for the child development through joint cooperation of the multidisciplinary medical team and caregivers. The Psychiatric Services. Psychiatric services provide aclinical psychological diagnosis using tests for IQ, psychoneurological personality disorders, learning disabilities, and other psychological tests. Psychological therapy services include psychobehavioral and family therapies. The Autistic Diagnostic Observation Schedule, or ADOS. The ADOS Clinic provides a semi-structured assessment of communication, social interaction, and play, or imaginative use of materials for children with autism using standard ADOS equipment. There is a set of simulations that allow children to practice and be observed. Their behavior is recorded from these observations, and the information is graded according to an ADOS criteria. Results are then used in diagnostic treatment. The Acupuncture Clinic provides delayed development acupuncture by doctors in order to stimulate development such as for children with autism, ADHD, cerebral palsy, learning disorder, and intellectual developmental disorders. This improves the equilibrium of the body and helps various organs maintain functionality by using acupuncture points located on the head. The Hemoencephalography Clinic. The HEG Clinic helps to stimulate blood flow to the brain and uses specific neural feedback techniques that train users to consciously regulate cortical blood flow and increase oxygen to activate necessary parts of the brain. Continual practice increases brain network development and blood vessels. Occupational therapy for children aims to facilitate their normal development and promote cognitive function. The Snoozelen Clinic, using the sensory integration theory, has achieved good results using sensory motor stimulation for behavioral modification and preschool preparation. Physical therapy. The physical therapy services treat child patients, especially those with gross motor problems, the primary cause often being rooted in the central nervous system, including delayed development of various motor functions and other developmental problems. Physical therapy through the use of specialist technical treatments stimulate a child's development, and skilled physical therapists trained in various techniques treat and integrate the children, as well as provide knowledge to the caregivers. The services are as follows. The Pediatric Physical Therapy Clinic provides skills for child development and neurodevelopment treatment, which was developed to treat underlying neuromotor deficits, posture and movement disorders, and encourage increased functional skill development. The Voyita Therapy Clinic provides treatment for children who have movement problems by using acupressure and posture to cause various muscle contractions and stimulate muscle function according to brain and nervous system procedures. The Hippotherapy Clinic uses horses to help treat children with mobility problems, as children learn to correct movements and posture in order to reduce muscle contractions. These horseback activities help autistic children to learn concentration and mood control, as well as stimulate verbal communication. This clinic exists because of the cooperation between the Institute and Taksin Camp Animal Battalion. The Hydrotherapy Clinic uses water's natural characteristics to treat children to move more easily with increased freedom, which helps reduce spasticity and strengthen their muscles. For autistic and ADHD children, the integration of hydrotherapy and sluzelin is used in treatment to increasingly get the child's attention and participation in various activities. The Skeletal and Muscles Physical Therapy Clinic is used to reduce pain of adults in general by using physical therapy equipment to check and plan treatment. Speech therapy. Speech therapy provides assessment, treatment, and improvement of language and speech development problems by speech-language pathologists to treat problems such as slowness of speech in autism and Down syndrome. The Communication Development Clinic. The Communication Development Clinic uses Picture Exchange Communication System, or PECS, for autistic children who either cannot speak or have limited speech skills. By teaching caregivers and children to use this technique at home, they are able to improve their communication. The Thai Traditional Medicine Clinic. The Thai Traditional Medicine Clinic provides integration of traditional and modern medical treatments to analyze, diagnose, treat, and rehabilitate by utilizing traditional treatments such as traditional massage, compress massage, and herbal medication. These techniques are helpful for stimulating learning ability of the brain, for calming children down, for better control of their behavior, and for strengthening their muscles, increasing joint movement, and helping reduce muscle spasticity. The Dental Clinic. The dental clinic promotes prevention and treatment of oral cavities in child patients, managing both physical and psychological factors by providing a suitable atmosphere through appealing surroundings in order to alleviate anxiety and undesirable violent behavior so that a child might receive appropriate dental treatment. Psychiatric social work. Psychiatric social work provides services to patients who have complex psychosocial problems by assessing their social, emotional, interpersonal, and socioeconomic issues and providing counseling and therapy for individuals, families, and groups to help find solutions. The Special Education Service. The Special Education Service provides preschool preparation and assists children with learning disabilities in various basic skills such as writing, reading, and mathematics. It develops individual and group life skills, including social and self-adjustment skills, in order to have a good quality of life and enter the school system. The Music Section. The Music Section provides individual and group musical activities, a 7-day, 7-color, and 7-note piano program, music and imagination, music and movement, and optic music, which uses technology to motivate body movement by integrating hearing, vision, and touch. Drama. Drama performance applies drama science to help develop social skills and interaction by stimulating and encouraging the imagination of autistic individuals with intellectual deficiencies, learning disabilities, and movement difficulties. The Art Section. The Art Section uses free drawing, painting, pottery and sculpting, making batik and fabrication activities to enhance development of feelings, concentration, thinking, creativity, and imagination. The Toy Library. The Toy Library is a resource center which enhances development by providing a toy borrowing service during government working hours, which allows a continuous training and improving of a child's development at home. The toy library consists of traditional Thai, modern, and international toys, fairy tales, word flashcards, and evaluation tools to promote child development from birth to 5 years of age by means of distribution by category. The RICD Wheelchair Project. The RICD Wheelchair Project provides and supports medical equipment to assist children and adults who have movement difficulties by cooperating with volunteers, Thai staff, and organizations located all around the world, both public and private. The RICD Occupational Training Center. The RICD Occupational Training Center for Special Individuals and Caregivers provides training and occupational development facilities, including a meeting room, accommodation, and a canteen with cooperation from private organizations which support employment. The Rajanagarindra Institute of Child Development develops by using the quality hospital standards of HA and ISO. In 2013, Rajanagarindra Institute of Child Development won the United Nations Public Service Award with the project Child First Work Together. The 2013 National Administration Award and the Service Integration Excellence Award. The RICD is committed to providing services in child mental health and development under the philosophy, "We will assist children and their families until they are able to depend on themselves." And the motto, "Academic Base, Impressive Service, modern technology towards international progress.